The UK government and Public Health England have been asking all of those patients coming back from Hubei province to inform them so that we can look to see whether they're developing symptomatology and obviously put them into containment and isolation so that we can try and prevent the spread of infection. Well, that's a big question, and it hasn't been tested as yet. But clearly, there is some requirement for social responsibility, not only to notify that they have come back and whether they're symptomatic or not, because clearly there is a significant problem of its spread out to the community at large. Now, we know that there are human-to-human transmissions occurring in China, and there's good evidence now that it's not a direct from animals to man, it's human-to-human now, and therefore there's every possibility that there will in fact be secondary and tertiary cases arising from any infection that we might be seeing now. So it's important that people notify, and then Public Health England will visit them and actually give them advice about the length of containment. They will undertake swabbing of them and give them results which will clear them of the infection or tell them that they are infected, and then the process of hospitalization and others will be required if necessary. The important thing is to recognize that spread can be from aerosol, that's the virus in the air, from droplets of infectious secretions from coughing, and from direct contact from surfaces. So hand-to-mouth contact is just as important as the prevention of breathing in these secretions. So it's clearly respiratory hygiene very important. It's important to have available hand sanitizers that can actually clean hands and kill the organism. Tissues, which in fact you can, if you're coughing, you can cough into, you can bin it, and you can kill the virus. But also, very importantly, to keep contained for this period of 14 days. And that's going to require voluntary and institutional containment. And obviously what will be really helpful is if the government and employers do allow people to be at home and on the guidance of PHE, that's Public Health England, to be away from work, and so that they're not penalised for being sick under the directions of the government.